You finally fall asleep. Then, 2 hours later, your eyes open. Your bladder is calling. You get out of bed, walk carefully through the dark, use the bathroom, and return to bed. Just as sleep begins to return, it happens again, then again. By morning, you are not rested. You are irritated, tired, and maybe even a little worried. You may ask yourself, why am I waking up to urinate so often? And the answer you usually hear is simple: drink less water at night. But for many adults over 50, that advice is incomplete. Sometimes drinking less at night helps. But if you are barely drinking during the day, eating salty dinners, drinking caffeine late, taking certain medications, or carrying fluid in your legs, the real problem may not be the last sip before bed. It may be your whole daily rhythm. I am Dr. James Walker, and today I want to explain how water timing, sodium, caffeine, alcohol, leg swelling, sleep, and bladder habits can all affect nighttime bathroom trips. Doctors call this nocturia. That simply means waking from sleep to urinate. It is common after 50 and even more common after 60. But common does not mean harmless. Waking once may not bother you much, but waking 2, 3, or 4 times can break your sleep, drain your energy, increase daytime fatigue, and raise your risk of falls on the way to the bathroom. So this is not only about the bladder, it is about sleep, balance, safety, and independence. Before we begin, please hit the subscribe button if you want calm, practical senior health guidance that explains what is happening in your body without fear or confusion. Many older adults accept poor sleep as normal aging, but sometimes the right habit change or medical check can make a real difference. Now let us begin with the biggest misunderstanding. Your bladder is not the only organ involved. Your kidneys decide how much urine is made. Your bladder stores that urine. Your brain wakes you when the bladder signal becomes strong enough. Your legs may store fluid during the day and return it to the bloodstream at night. Your medicines can change how much urine you make. Your blood sugar can pull more water into urine. Your prostate, pelvic floor, sleep quality, and heart health can all play a role. That is why nocturia is not always fixed by one simple rule. A person can stop drinking after dinner and still wake several times. Another person can drink a little water before bed and sleep all night. The pattern depends on the cause. Now, what changes after 50? First, the bladder may become more sensitive. It may send the urge signal earlier than it used to. Second, sleep becomes lighter for many people. If you wake easily, you may notice bladder sensations that would not have awakened you years earlier. Third, some people make more urine at night. This is called nocturnal polyuria. It means a larger share of your daily urine is produced while you are trying to sleep. Fourth, medical conditions become more common. Diabetes, high blood pressure, heart failure, sleep apnea, prostate enlargement, overactive bladder, urinary tract infection, kidney problems, leg swelling. All of these can contribute. So if you are waking often, do not automatically blame age. Age may increase risk, but it is not a complete diagnosis. Now let us talk about the first mistake: not drinking enough during the day. Many people who wake at night become afraid of water. They start cutting fluids earlier and earlier. At first this sounds logical. Less water in, less urine out. But if you drink too little overall, urine can become more concentrated. Concentrated urine may irritate the bladder in some people. That can create urgency even when the bladder is not very full. You may feel like you need to go again and again. Also, if you underdrink all day, you may become thirsty in the evening. Then you drink several large glasses after dinner, exactly when your body has the least time to process them before sleep. So the better strategy is often not severe restriction. It is better timing. For many people, the goal is to drink steadily earlier in the day. Begin in the morning. Continue through lunch. Keep sipping in the afternoon. By dinner, you should not feel desperate to catch up. This does not mean forcing huge amounts of water, and it does not mean everyone needs the same number of cups. Fluid needs depend on body size, activity, weather, sweating, medications, kidney function, heart conditions, and your doctor's instructions. If you have heart failure, advanced kidney disease, low sodium, or were told to limit fluids. Follow your medical plan. Do not copy a general water rule from the internet. But if your doctor has not restricted fluids, and you routinely drink very little all day, shifting more fluid earlier may help. A simple routine is this. Have a drink after waking. Have another with breakfast. Sip between breakfast and lunch. Drink with lunch. Sip again in mid-afternoon. Then reduce the amount gradually in the evening. You are not shutting the tap completely. You are moving the main hydration window earlier. Now, if this is already making sense, subscribe now. Nighttime urination is one of those problems people joke about, but it can quietly ruin sleep and increase fall risk. This channel helps you understand the real causes so you can fix the right thing. The second mistake is catching up at night. This is extremely common. A person drinks almost nothing until late afternoon. Then, around dinner, they realize they are thirsty. They drink water with dinner, then tea, then another glass with pills, then maybe soup or fruit, then one more glass beside the bed. By midnight, the bladder is doing exactly what it was asked to do. It is storing all the fluid that arrived too late. The better approach is the 2-hour taper. About 2 hours before bedtime, begin reducing fluids. This does not mean you are forbidden to drink. If you are thirsty, take small sips. If you need water with medication, take it. If your mouth is dry, moisten it. But avoid large drinks close to bedtime unless your doctor has told you otherwise. Think of it like landing an airplane. You do not slam down suddenly, you descend gradually. Your fluid intake should do the same. Most of the day's fluid earlier, smaller amounts later, a gentle taper before bed. Now, if you take evening medications, ask your doctor or pharmacist whether any of them can be taken earlier. Do not change timing by yourself. Some medicines need specific timing. But it is worth asking, especially if you take water pills, blood pressure medicines, sleep medicines, or other drugs that may affect urination. The third mistake is ignoring caffeine. Caffeine can irritate the bladder in some people. It may increase urgency. It can also affect sleep. Even if it does not make you urinate more directly, it may make sleep lighter, and lighter sleep makes every bladder signal easier to notice. Coffee, tea, cola, energy drinks, chocolate, and some medications may contain caffeine. The timing matters. A cup of coffee at 7 in the morning is different from strong tea at 5 in the evening. If you are waking at night, try moving caffeine earlier. Many people do best by stopping caffeine by early afternoon. Some sensitive people need to stop even earlier. Others tolerate a small morning cup without trouble. The only way to know is to test your pattern. For 1 or 2 weeks, keep caffeine earlier and track nighttime bathroom trips. Do not guess. Track. Now, alcohol deserves its own mention. Alcohol may make you feel sleepy, but it often worsens sleep quality. It can increase urine production. It may relax the throat muscles and worsen snoring or sleep apnea. It can also make nighttime walking more dangerous because balance and judgment may be impaired. A glass of wine or beer with dinner may be enough to worsen nocturia in some people. If you wake often, try avoiding alcohol in the evening for a couple of weeks and see what changes. This does not have to be a forever decision. It is an experiment. Your bladder and sleep will tell you whether it matters. Now let us talk about sodium. This is the part many people miss. Salt affects fluid balance. When you eat a high-sodium meal, your body has to manage that extra sodium and the water that comes with it. For some people, especially those with high blood pressure, heart disease, kidney disease, or leg swelling, salty dinners may contribute to nighttime urine production. That does not mean salt instantly turns into urine at midnight. The body is more complex than that. But sodium intake can affect thirst, fluid retention, blood pressure, and how much fluid the kidneys process later. The practical rule is simple. Make dinner lighter in sodium. If you want a saltier meal, lunch may be a better time than late dinner because your body has more waking hours afterward. Watch soups, sauces, processed meats, frozen meals, chips, restaurant food, pickles, cheese, and packaged snacks. These can carry more sodium than people realize. Use flavor without relying only on salt. Lemon, vinegar, garlic, onion, herbs, pepper, salt-free seasoning blends. But read labels if you have kidney problems because some salt substitutes contain potassium chloride, which is not safe for everyone. A lower sodium dinner may reduce thirst and may help some people wake less. It is also good for many people with high blood pressure. Now, the fourth mistake is ignoring leg swelling. This is one of the most overlooked causes of nighttime urination. During the day, gravity pulls fluid down into the legs. Some people notice swollen ankles by evening. Others do not see dramatic swelling, but fluid still collects. When you lie down at night, that fluid returns to the bloodstream. The kidneys then filter more fluid. The bladder fills. You wake up. This can happen in people with vein problems, heart failure, long sitting, certain medications, or reduced mobility. One simple habit may help some people. Elevate your legs in the evening before bed. Not while sleeping necessarily. Before bed, sit with your legs raised for 15 to 30 minutes if this is comfortable and safe for you. This gives some fluid a chance to return and be processed before you fall asleep. Gentle ankle pumps can also help. Point the toes, pull them back, circle the ankles, repeat slowly. Compression stockings may help some people, but they are not for everyone. Ask your doctor if they are appropriate, especially if you have circulation disease, heart failure, diabetes, or skin problems. And if swelling is new, one-sided, painful, red, warm, or associated with shortness of breath, do not treat it as ordinary aging. Seek medical advice. Now, before we go further, please hit subscribe if this practical explanation is helping you. Many people are told only to stop drinking water at night, but no one explains the role of sodium, caffeine, alcohol, leg fluid, medications, and sleep apnea. Subscribing helps you keep getting the full picture. Now, the fifth habit is emptying the bladder properly before bed. This sounds obvious, but many people rush. They brush their teeth, turn off lights, quickly urinate, and go to bed. The bladder may not fully empty. Then, a short time later, the urge returns. Before bed, give yourself time. Sit comfortably. Relax the belly. Do not strain. Let the urine flow finish. Wait a few moments. Sometimes standing, washing your hands, then sitting again briefly can help some people empty a little more. This is called double voiding. It can be useful for people who feel they do not empty completely, but do not force it. Do not push hard. If you regularly feel unable to empty, have a weak stream, dribbling, pain, or frequent urgency, ask a doctor. In men, prostate enlargement can contribute to slow flow and incomplete emptying. In women, pelvic floor changes, bladder prolapse, and other conditions can contribute. Both men and women can have overactive bladder, infection, medication effects, or neurological causes. Again, the symptom is common, but the cause can vary. Now let us build a real day. Morning. Wake up and drink a reasonable amount of fluid if your doctor has not restricted you. Take medicines as directed. If you drink coffee, enjoy it earlier rather than late afternoon. Mid-morning. Sip water. Do not wait until you are very thirsty. Lunch. This can be your larger meal if that fits your lifestyle. If you eat something saltier, earlier in the day may be better than late evening. Afternoon. Continue light fluids. Begin watching caffeine timing. Late afternoon. Start noticing your legs. Are your ankles swelling? Have you been sitting for hours? Do some ankle pumps. Take a short walk if safe. Dinner. Keep sodium lighter. Avoid making soup, salty sauces, processed meats, and large drinks the center of the evening meal. If nighttime urination is a problem, 2 hours before bed, begin tapering fluids. Small sips are fine. Large drinks are not ideal for most people with nocturia. Evening. If your legs swell, elevate them for 15 to 30 minutes and move the ankles gently. Before bed, use the bathroom calmly. Empty without rushing. Make the path to the bathroom safe. Use a nightlight. Remove loose rugs. Keep glasses, slippers, and walking aids within reach. This last point is important. If you wake at night, safety matters more than speed. Falls happen when people hurry in the dark. Turn on a light. Sit at the edge of the bed for a few seconds. Stand carefully. Use support if you need it. Now let us discuss when nocturia needs medical attention. If you wake once nightly and feel rested, it may not be a major problem. But if you wake 2 or more times and it affects sleep, mood, energy, safety, or daily function, it is worth discussing. See a healthcare professional if nocturia is new, worsening, or associated with pain, burning, blood in the urine, fever, pelvic pain, sudden urgency, leakage, difficulty starting urination, weak stream, or feeling unable to empty. Also, ask for evaluation if you have excessive thirst, weight loss, very high blood sugar, swelling, shortness of breath, loud snoring, or pauses in breathing during sleep. Sleep apnea is a major hidden cause. When breathing repeatedly stops during sleep, the body releases signals that can increase nighttime urination. Some people treat the bladder for years when the real problem is sleep apnea. If you snore loudly, wake choking or gasping, feel very sleepy during the day, or your partner notices pauses in breathing, ask about sleep testing. Now, your doctor may ask you to keep a bladder diary. This is one of the most useful tools. For several days, write down what time you drink, what you drink, how much you drink, when you urinate, and how much urine comes out if you can measure it. Also record bedtime, wake time, caffeine, alcohol, swelling, and accidents. This diary can show whether you are making too much urine at night, drinking too late, urinating small amounts due to bladder urgency, or waking for another reason and then deciding to urinate. That last point matters. Sometimes people wake because of insomnia, pain, sleep apnea, anxiety, or noise. Then, because they are awake, they use the bathroom. They assume the bladder caused the waking, but the bladder may not be the original cause. A diary helps separate these patterns. Now, if you take a diuretic, commonly called a water pill, ask about timing. Do not change it yourself, but timing can influence nighttime urination. Some people take it too late in the day and then wake repeatedly. Others need it at a specific time for heart or blood pressure reasons. Your doctor can decide. Also review medicines such as lithium, some antidepressants, bladder medicines, sleeping pills, and blood pressure medicines because medication effects can be part of the picture. Now, let us talk about what not to do. Do not stop drinking water completely. Dehydration can worsen dizziness, constipation, confusion, kidney problems, and concentrated urine. Do not take bladder supplements without checking interactions. Do not use someone else's prescription. Do not stop prostate or blood pressure medicine because of nighttime urination. Do not ignore blood in the urine. Do not treat repeated nighttime falls as bad luck. And do not accept 4 nightly bathroom trips as normal aging without asking why. Now, if this video is giving you a clear plan, subscribe before we finish. Your sleep affects your memory, blood pressure, balance, energy, and mood. A better night is not a luxury after 50. It is part of staying independent. Now let us repeat the 5-rule method. Rule 1. Move most of your fluid earlier in the day. Rule 2. Taper fluids during the last 2 hours before bed, while still taking small sips or medication water when needed. Rule 3. Move caffeine earlier and limit evening alcohol. Rule 4. Keep dinner lower in sodium and watch salty sauces, soups, and processed foods. Rule 5. If your legs swell, elevate them before bed, then empty your bladder calmly before lying down. Try this for 7 nights. Track how many times you wake. Track what time it happens. Track what you drank. Track what you ate at dinner. Track whether your legs were swollen. You are not looking for perfection. You are looking for patterns. If the number improves, you have learned something valuable. If it does not improve, you have useful information to bring to your doctor. That is still progress. Before we close, remember this. Nighttime urination is not one problem. It is a symptom. For one person, it is late tea. For another, salty dinner. For another, prostate enlargement. For another, sleep apnea. For another, leg swelling. For another, uncontrolled diabetes. For another, a medication schedule. The right solution depends on the cause, but water timing is one of the safest places many people can begin, not by starving the body of fluid, not by fearing every sip, but by giving the body most of its fluid earlier, then allowing the evening to settle. I am Dr. James Walker. Tonight, do not just drink less, drink smarter. Set a rhythm. Make the path to the bathroom safe. And if your nights are still broken after a few weeks, ask for a proper evaluation. Because better sleep after 50 is not just possible, It may begin with something as simple as when you drink, what you eat at dinner, and whether you give your body time to empty before the lights go out.